Teacher, my name is Luis Caguil Briones, and today I talk about acute hydrophilic polymer nephropathy and acute renal failure. Definitions. Hydrophilic covering are used on intravascular devices to facilitate manipulation and to minimize complications such as vasospasm during a procedure and thrombosis after procedure.
Kidney failure can happen sort of in sort of two broad sort of temporal categories, and there are variations in between, but some people will have a chronic disease, diabetes, high blood pressure, polycystic kidney disease, that causes slow damage to their kidneys over time. In certain circumstances, there can be sudden insults to the kidney. Typically very sudden drops in blood flow to the kidney related to low blood pressure. Sometimes toxic substances can affect kidney function, and this is a sudden thing.
Applications in medicine. The patients underwent renal transplantation in which the renal artery was implanted into right external iliac artery. Between January and June 2013, her serum creatinine level increased progressively over a 5-month period. Pros and cons. Pros. Polymer-coated interventional devices are used frequently, and the diagnosis of pulmonary emboli is unlikely, since emboli usually lodge in the arterioles of downstream organs. Cons. The associated event range from non-detectable event to myocardial infarct, stroke, and death within days to months. Computer tomographic angiography revealed stenosis of the common iliac artery. Usu apply in Ecuador. This renal lesion may be induced by hydrophilic polymer emboli. We speculate that the stent in the iliac artery was the most likely source of the emboli in light of the anatomical proximity to the anastomosis.
I am Dr. Vishwanath, consultant nephrologist and HOD nephrology. I am working at Manipal Hospital, Bangalore. Acute renal failure is what is also called as acute kidney injury, because it is called acute kidney injury because most often any injury will recover. So acute kidney failure also will recover. 99% of the times acute renal failure means it is acute renal shutdown, where whatever has caused kidney failure, once it gets better, kidney will improve. The most common causes of acute kidney failure is in an ICU setting where blood pressures are low, they have some infection, where there may be significant involvement of the kidney. Once we treat it appropriately, it will get better. The other most common causes of acute kidney injury are significant blood loss. Somebody has road traffic accident, loses a lot of blood, or they have significant low blood pressure, which may lead to acute kidney failure. As I said, 90 to 99% of the times acute renal failure, if it is picked up early, treated appropriately, can be definitely prevented, and most often these individuals, the kidney function gets back to normal what it was in the original state. Chronic kidney disease is the one where there is a relentless progression. It's a permanent kidney damage and more or less irreversible kidney damage. If we detect it early, definitely we can do something to prevent.
Conclusions. In conclusions, the current case highlights what we consider to be under-recognized iatrogenic complications. Emboli Fahrenheit material may be present in patients who have undergone recent implication of an intravascular device with a hydrophilic coating.
When Howard Hughes was 19, his father died, leaving him in charge of the Hughes Tool Company. He dropped out of Rice University and decided to use his wealth to make movies. His movie Two Arabian Nights won a 1928 Academy Award, and Hell's Angels won a 1930 Academy Award. He then bought RKO Studios in Hollywood and later sold it for a $6.5 million profit. He learned how to fly, set several flying records, and formed the Hughes Aircraft Company. In 1938, he set the record for the fastest flight around the world at 91 hours. In 1946, he built the largest airplane ever made, the H-4 Hercules, also known as the Spruce Goose. He bought TWA, or Trans World Airlines, and established the Howard Hughes Medical Institute. He moved into real estate, and one day when staying at the Desert Inn in Las Vegas in 1966, he was asked to vacate his room. Well, he didn't want to leave, so instead he just bought the hotel. He then spent the next 10 years buying and living as a recluse in hotels throughout the world. For the last 4 years of his life, he lived in penthouses of his hotels, the Xanadu Princess Resort in the Bahamas and the Acapulco Princess in Mexico. He had hip surgery in 1973, and afterwards he chose to never walk again, living entirely in his bed. He became increasingly eccentric and stopped bathing, cutting his hair, and cutting his nails. He had a chronic pain that resulted from a plane crash that he was in when he was test piloting years earlier. From that, he became addicted to codeine, and he would self-inject codeine into his muscles. He developed weird eating habits and began to lose weight, eventually weighing only 90 pounds. Well, the codeine alone wasn't enough to control his pain, so he started taking more and more aspirin to the point that he was taking 20 to 30 aspirin tablets a day. In April 1976, he became dehydrated, and that, on top of his enormous aspirin use, led to acute kidney failure. He refused all blood tests and x-rays. His doctor arranged to fly him from Mexico to Houston to get treatment, but he died before the plane could leave Mexico. Because it was common at the time for countries to hold corpses as ransom so that estates could not be settled, the pilot didn't announce Hughes' death until after they entered U.S. airspace. The cause of death, acute kidney failure. Well, Howard Hughes is one of the more bizarre cases of acute renal failure, but acute kidney injury is extremely common, and I see it virtually every day in our ICU. Today on MedNet, we're going to look at acute kidney injury from two unique perspectives. First, to tell us how acute kidney injury is actually a multi-organ system disease, nephrologist and assistant professor of enteral medicine, Dr. Uni Bhatt. And then to tell us about the emerging field of onconephrology, assistant professor of enteral medicine, also from the division of nephrology, Dr. Jason Prozek. Uni, Jason, welcome to the program.
Thank you, Jan.
Thank you. Well, Uni, dehydration and aspirin knocked out Howard Hughes' kidneys. What are the most common causes of acute renal failure in a typical hospital practice?
Again, very similar to Howard Hughes' story. Probably dehydration is probably the most common thing, whether it be associated with other illnesses such as gastroenteritis, acute bronchitis, things like that, that decreases oral intake. That in addition to nephrotoxin exposure, such as with, again, non-steroidal anti-inflammatory drugs like aspirins, ibuprofens, etc. Those are probably the most common things that we see.
Well, Jason, why are nephrology and oncology so tightly intertwined?
Thank you, Jim. So we are seeing that in a cancer hospital, 15% of all hospitalizations have acute kidney injury as one of their admitting diagnoses. That is 3 times higher than the background rate for non-cancer patients. Of that population, 50% had hyponatremia, and many patients will resultantly have chronic kidney disease simply by surviving their cancer chemotherapy treatment. So there are nephrologic complications along the whole spectrum of cancer treatments.
Well, thanks, Jason. Let me remind you that you can email us with your questions about acute kidney injury using the email feature on your MedNet webpage. And now let's get started with a look at the epidemiology and clinical consequences of acute kidney injury. Uni?